Lynn continues to take her daughter in to see Luann every 6 months. And each time, she assures the nervous mother that all is well. At Jessica's 3-year checkup, it becomes clear that the genetic counselor is far more worried about Lynn than her daughter.
Luann asked me, every time I see you, you're in a different cast.
So started asking her a lot more questions about her health history. I felt it was important that I make her aware of a condition that might explain her problems.
Lynn can't believe what Luann is suggesting. She spent nearly 15 years hearing that she's just different, but secretly, she's always suspected there was more going on.
I was totally desperate for some kind of answer to all the aches and pain that I had since I was 15 years old.
Luann advises Lynn to get in touch with a genetic specialist immediately. She tracks down Dr. Pamela Trepane and hands over her extensive medical file. Dr. Trepane begins conducting her own investigation by having Lynn perform very specific tests on her joints.
There is a scale that we use to be able to assess joint instability and joint hypermobility.
In other words, how mobile are her joints? Looking at her skin, how stretchy it is.
Based on that type of a physical exam, in addition to her medical history, makes that diagnosis. Lynn has classic features of Ehlers-Danlos Syndrome.
Ehlers-Danlos Syndrome is a disorder in which a genetic mutation disrupts the patient's production of collagen, a type of protein that acts as a glue and holds our skin, muscle, and ligaments together. Without the adequate collagen, Lynn's body, quite literally, began falling apart.
Lynn's joint pain is a direct result of the poor collagen and the poor elasticity. Many children, their parents will describe them as being clumsy, when in fact they're trying very hard to keep their whole body in appropriate alignment.
You think back and think, well, maybe she wasn't the klutz that we thought she was. It was related to this condition that she had no control over.
Dr. Trepane speculates that Lynn's pain progressed slowly from her hands and wrists to other body parts because the joints that are used most often feel the wear and tear first.
When Lynn was pregnant, she felt even more fatigued. We're already talking about joints that are unstable, and now you're adding the load of the pregnancy on top of that and a shifting center of gravity. All of those things then will combine to create increased joint pain. Historically, people who had classic Ehlers-Danlos syndrome had incredibly stretchy skin. Within circus environments, you see the people that can stretch their skin, taking their earlobes and pulling them down.
You know, one of the big puzzles, of course, for Lynn was why it took so long for people to make this diagnosis.
She did not have overly stretchy skin. Unfortunately, what most physicians have learned is that's EDS.
While it's reassuring to finally know what she's been living with all these years, Lynn is not prepared for what the doctor has to say next.
There is no cure for EDS. We cannot go in and fix the gene that is making the collagen incorrectly. We can, however, provide good pain control and good physical therapy.
Lynn begins a rigorous course to strengthen and steady her joints and takes prescription medications to help manage her pain. Unfortunately, she will continue to require surgeries to tighten up her ligaments as they wear out.
I'm trying to go and do the best I can each and every day. Every day is a new day.
To date, Lynn has had more than 40 surgeries. She also wears custom-made silver ring splints to help stabilize the joints in her fingers.
I wear these just to prevent tearing in my ligaments in my fingers, and also it really does help with pain.
Lynn is still coming to terms with the fact that her disease will never go away. But she finds her inspiration to face each day through her husband's unwavering support.
It takes a special person to marry somebody and still stand by my side. 33 years since we met.
It's for better or worse in sickness and health, and that's pretty much what I've stood by.
Today, Dave and Lynn remain hopeful for a cure. In the meantime, she's doing all that she can to help patients like herself. In 2006, she started the Ehlers-Danlos Syndrome Network Cares.
You have to be your own advocate. I hope someday every doctor knows something about